Hello everyone, and welcome to today's webinar. It's great to see so many people online for the launch of our Nursing and Perioperative Research Network this afternoon. My name is Katie Shaw. I'll be the facilitator for today's webinar. For those of you who've not met me, I'm a senior lecturer at the University of Edinburgh, and I'm also the co-chair of the Capacity Building Committee here at the NIHR Global Health Research Unit on Global Surgery. So it's a particularly exciting time for us today as we launch this new Nursing and Perioperative Research Network. Today's webinar will discuss the importance and challenges around perioperative nursing handovers, focusing on low resource settings. We'd like the session to be as interactive and conversational as possible, please. I know that's difficult when we have lots of people online, but do feel free to type questions in the chat box as we go along. And to get us started, we're going to have a few polls. Just some little votes for fun in the chat box. So we'd like to start by asking the audience online today, how many of you have taken part in research before? Have you done some data collection? Have you done some audit in your own hospital? Vote yes or no in the poll, which I am going to launch now in the chat. So you should be able to see the poll and to vote, and we'll keep an eye on the votes as they come in, and we'll see how many of our audience have done some research before in the past. So we're going to have a brief outline of today's webinar. Oh, I can see a hand raised already in the chat. Did somebody want to ask a question? Soweto. No, the hand's gone down. Okay, we'll keep going. Pete, could you move to the next slide? I think we have an outline of the webinar. So we're going to have some brief introductions to our new network, and followed by a panel discussion where we'll hear from key nursing and perioperative experts from across the Global Surgery Unit network. They'll discuss examples of perioperative handovers and share insights from their own practice. And following that, we'll have a panel discussion, we'll have an opportunity to hear about the new nurse-led research project from Dr. Sangeeta Samuel, who is from our GSU India hub and is chairing our new Nursing and Perioperative Research Network. So first of all, I'd like to introduce Professor Dion Morton. Professor Morton is a Professor of Surgery at the University of Birmingham and the co-director of the NIHR Global Surgery Unit. So, Dion, as you know, we've recently celebrated International Nurses Day, which is held every year on the anniversary of the birth of one of the world's most recognised nurses, Florence Nightingale. Could I ask you to say a few words about the importance of this new nurse-led research initiative to the GSU and how this aligns with the future direction of the unit's research?
Katie, Sangeeta, and everyone, it is a huge pleasure to be here and join you. I'd like to thank Katie for choosing a picture of me that's actually from 10 years ago when I was much younger. I'm sadly much older now, but it's really lovely to be here with you all. Launching this nursing webinar, the first in our collaboration, is a real pleasure, and it is a huge step forward for our network. The most important thing in our network is benefiting our patients. And we know that we have to have strong teamwork across all the disciplines to benefit our patients and make sure they get a good outcome from their treatment. The nurses are an essential part of that. And for our nursing network to now be leading research across the world is a fantastic step forward. And the Global Surgery Unit and I, as one of the co-directors of the unit, will fully support this initiative. And we look forward to you not only leading your own research, but leading your own global group that we will help and support in its development. This is your first global webinar, and I believe it will be the first of many. Your direction today is focused around perioperative care and handover, and that is an incredibly important part of surgical care and something that surgeons need to be educated in, and nurses can support surgeons in that education. So I wish you well in this meeting today. I'm looking forward to hearing about the research proposals. And it is my pleasure now to hand over to Dr. Sangeeta Samuel, who is the leader of this nursing network. And although Sangeetha, you've been working on this, I know, with us for well over a year or 2 years now in developing this network, tell us what the new initiative is and where you see this going. Sangeetha, over to you. Thank you.
Thank you, Professor Dion. Thank you for giving this opportunity for the nurses to grow in the global surgery unit. So as we already know, I'm going to discuss how we started this global surgery collaborative network and something about the eDelphi we did to identify the perioperative nursing research priorities in low and middle income countries. Next slide, please. So Global Surgery Nursing Collaborative was established in 2002 when we met in New Delhi for our annual meeting. And this was the quote that I used to present after the small group discussion, which I still hold as very important. That's outcome of surgery is not dependent solely on surgeon skills, but on the completeness of the surgical nursing, competence, and compassionate care. And that's why we are here, because we constitute the largest health workforce and we play a key role in improving the results in the surgical care. Carrying out the meaningful research that can support the importance of surgical patients' outcome and strengthening the nurse's position that influences healthcare system and the generation of evidence. However, nursing research presents challenges to be overcome. So to face all these challenges, next slide, please. So we have this network which has a goal to strengthen the contribution of skilled workforce, that's nursing and allied health professionals, in delivering optimal perioperative care to improve surgical outcomes for the patients, to build surgical nursing research and research management capacities through education and training for nurses to facilitate collaborative work in existing global surgery teams. And we also look to build a global consensus on the nursing priorities for perioperative research. And we look to build capacities and capabilities to advance the perioperative nurse workforce with the focus on low and middle income countries. And we work in collaboration with Edinburgh Global Nursing Initiative. And you please feel free to contact us for further research proposals. For this next slide. I just want to give an overview of how did we reach to a what research priorities that we have to concentrate on. So we did this eDelphi, a multi-stage group facilitation technique that seeks to obtain consensus on perioperative nursing research priorities in LMICs. The Delphi was conducted in 3 rounds. The round 1 with an objective of round 1 was to identify broad perioperative nursing research themes. Next slide, please. Total of 162 nurses around the world participate in this anonymous online survey during August 2023. Majority of the participants were female surgical nurses with postgraduate degree in nursing, working in teaching hospitals, and were mostly from India and Nigeria. Next slide, please. We identified 20 themes that were identified in the round 1. Next slide, please. And in round 2, the themes were prioritized according to their importance. So in round 2 was conducted during August first week to September. Total of 169 participants participated in the survey. Majority of them were females, postgraduate surgical nurses from teaching hospitals and from Nigeria and India. Next slide, please. After prioritization, we shortlisted our priorities to 10 top priorities. And the stage 3 was conducted during our annual meeting in Nigeria. Next slide. Where we had a voting system where all the participants of the annual meeting, including surgeons, anesthetists, nurses, participated, and we came to a conclusion what are the top 5 priorities that we are going to work on. The first priority was effectiveness of patient safety measures in perioperative care. Second was post-operative complications. third was existing and best practices in infection control practices in perioperative nursing. Pre-operative preparation of patient and analysis of practice in operating room. With these priorities, we worked on identifying what are the patient safety measures that we can start working about on a research proposal. So what we came about is the perioperative handing over practices that has a challenge, and that is the challenge which we face in low and middle income countries. So we chose this topic to work on further. Next slide, please. So I acknowledge Dr. Dhruv, Dr. Aisha, Dr. Vinita, Dr. Catherine, and the Nursing Collaborative core team and the nursing department of CMC Ludhiana and the Global Health Network, and Tom and Malcolm who helped us in the voting and the annual meeting. So with all our work, this is the perioperative handing over practices that we face challenge, and we are trying to find solutions together globally. Thank you so much.
Thank you, Sangeeta. That's great to hear that the study protocol has been co-developed and co-led across the GSU network. It's so important that our research is locally led and context-specific and co-designed by our partners. I can see somebody in the audience, Anjale, has got their hand up. Would you like to come in with a question? Or if you prefer, please do type it in the box. Just while we're sorting that out, I'm going to tell you that we've got an audience of expert researchers in the audience today. 77% of people in the poll have some experience of research already. So that's fantastic that we have got some experienced researchers online today already. So there's two other raised hands. Do people want to come in? Angela, Sosentha, I'm sorry if I'm getting people's names wrong. Please do turn your microphone on and come in. I'm being told the chat is disabled and it's not possible to unmute. Lucy, are you able to enable the chat?
Yes, bear with me a second.
Thank you. Okay, well, we'll keep going for now. So
chat's enabled, so everyone should be able to type their questions in.
Thank you. We'll move on for now, and I'd like to introduce Dr. Vinitha Ravindran. Vinitha is the Dean of the College of Nursing at the Christian Medical College in Vellore, also representing our Global Surgery India hub. Vinitha, the perioperative period, as we know, includes the time from when a patient is admitted for surgery to the point when they're discharged to leave. So it includes lots of preoperative time, the operation itself, and the postoperative period. Could I ask you to start by telling us what exactly is meant by the perioperative handover and why it's important in the context of low resource settings?
Yes, sure, Katie. Good evening, everyone. It's my pleasure to just say this introductory remarks on the perioperative nursing care. May I have the next slide, please? So as we all know, this is a definition that we all know. Just a review of the definition of handover can be defined as a process by which a patient or information relevant to the patient and the equipment and professional responsibility and accountability are transferred from one person or one care team to another. That's what handover is. In the next slide, we can see within the perioperative setting, how does this handover happen? Like Katie rightly said, it's from the time that the patient is ready to come into theater or the OR to the time that the patient is leaving the operating room to different places. There are three phases in the handover: preoperative, intraoperative, and postoperative. And if you look at this picture, it clearly tells us what types of handover and when and where things can happen. So in the preoperative period, patient can enter into theater from emergency or the floor or the holding room, may come to the holding room and then enter operating room. And every time the patient moves from one place to another, there's a lot of things that need to be handed over, including information and things. And in the operating room, there's a lot of things that need to be checked and handed over. And once the surgery is over, the patient comes either to the post-anesthesia unit or may be transferred to intensive care unit or may go back to the floor. And every time when the movement happens, there is this handover that needs to happen to make sure that the patient is safe and effectively transferred from one place to another. Next slide, please. So why is this important? Why is this handover important when this patient is moving from one phase to another, one place to another? We have to remember that it includes multiple health team members. And these patients, they are surgically ill. They have come into the OR, they are anesthetized, they are critically ill. Not only the patient, but many equipment along with them may have to be moved when the patient is moving from one place to another. And there may be so many documents that have to go with the patient. There's too much activity that happens, especially within the theater or when they are moving out of the OR. And there are many handovers like we saw in the last slide. And communication failure causes, we know from studies that 70% of the things, errors that can be preventable happens because of communication failure. And most of the communication errors occur during handover. And therefore, handover becomes very important. And that's the reason that we are having this panel discussion at all today. And we want to concentrate on that in our research as well. Over to you, Kate.
Thank you, Vinitha. So the perioperative handover is the sharing and transferring of critical patient information between the healthcare teams, either as the team changes or as the patient moves around the hospital. So it's clear to see why that's so important that we have a good handover practice and why it's invaluable for patient care, for that to work properly. So we're going to move on now to the panel discussion, and I'd like to invite Sangeeta to introduce today's panel. Have we got the next slide? As Sangeeta introduces the panelists from across the GSU network, we'll launch the next poll in the chat. So we're going to hear from the panel about challenges in perioperative handover, but we'd like to hear from our audience too. What are the challenges you face in your own practice around perioperative nursing handovers? You're going to see a multiple choice poll arrive, and you can vote for as many challenges as you face. You can pick more than one. So Sangeeta, over to you to introduce and lead the panel discussion, please. Sangeeta, you're muted. I think you'll need to unmute your microphone.
So thank you, Katie. Thank you for giving the panel discussion over to me. I'm privileged to introduce my panelists who are working with me since 2 years on this network. We have Mrs. Lynette from South Africa Hub. We have Dr. Vinitha Ravindra from the Global Surgery Hub, India, from Vellore. We have Dr. Rwanda from Global Surgery Hub, Nigeria. We have Professor Aisha, who's been our mentor and guide. We have Mrs. Amandeep Kaur from GSU India Hub. And we have Miss Esperance from Rwanda Hub. And we have Mr. Blaise from Benin Hub. So we are all going to share our thoughts about perioperative handing over practices. So to start the session, I'd like to ask, next slide, please. To start a panel discussion, I'd like to request Mrs. Yuwanda from Nigeria Hub to share some primary challenges that we face in perioperative nursing handing over practices in our low resource setting. And also you can share how does this differ from the high resource setting?
Okay, thank you very much, Sangeeta, and good day to everyone. Good day to everyone. Now, I'm supposed to talk about some of the challenges faced in low resource setting. And there are a lot of challenges that we face in low resource settings. Firstly, lack of standardized guidelines, and that is lack of national guidelines. There are no national guidelines, plan or order that is being used for perioperative nursing handover in most of the low resource settings. And this can affect handover practices adversely. And if there's national protocol, this will also assist incoming and outgoing perioperative nurses to have good perioperative handover practices in low-income countries. Secondly, lack of coordination with other departments. And there are a lot of departments that are involved in treatments of patients, such as anesthesia department, surgery, radiology, and laboratory support, e.g. blood transfusion. And if there's good coordination, this will ensure availability of all necessary resources, such as human and material resources. But if these resources are not in place, it can be challenging, especially when schedules and priorities are conflicting. This can also lead to lack of feedback, lack of readback, lack of closed-loop communication, and lack of cross-monitoring. Thirdly, because of our time, there is also a challenge of ineffective communication. It's a primary challenge in low-income countries, and if there's lack of effective communication, it can affect the standard of perioperative nursing handover practices, whereas effective communication ensures everyone involved in the care of the patients and has the same information if there's effective communication. But if there's lack of communication or ineffective communication, it can result to incomplete information, incorrect information, also missing clinical information. It can also affect the perioperative handover practices in low-income countries or low-resource settings. Lastly, time constraint is another primary challenge faced in perioperative nursing handover practices in low-resource settings. Managing time efficiently to complete all preoperative tasks while ensuring thoroughness and accuracy can be challenging, especially when unexpected issue arises or when multiple surgeries are scheduled simultaneously. And this can be a challenge in nursing handover practices. I would like to stop here. Thank you, Sargenta, and thank you for following me. Thank you very much.
Thank you for sharing some of the challenges like lack of standardized guidelines, lack of coordination, communication challenges, time constraint. Wherever we are, we know that these are the challenges that we face. We all are in the same boat. But do you think it differs from those of the high resource setting?
Yes, it's different because when we talk about low resource setting, we are talking about low-income countries. And if you compare it with high-income countries, they are not exactly the same, even though the high-income countries, they have their problems too. But let me just make mention of one or two. First of all, they follow standardized protocol in the high resource setting. And perioperative nurses in high-income countries follow strict guidelines, unlike low-income countries. And this can sometimes lead to delay in intervention because they actually want to follow everything systematically and touch every aspect. And by doing this, there's delay in intervention. So it's a challenge to high-income countries. Then also because they want to follow the protocol strictly, and they do this in order to avoid medical legal issues. Secondly, there's also over-reliance on technology in high resource settings, such as electronic medical records and the internet. So when there's outage in power or internet services, this could result in severe consequences of loss of data or inaccessible data. That is a challenge for high-income country. Then also, computer can also face technical errors, even though they have everything there they are developed. But it is not impossible for computer to develop technical errors. Also, there's also a challenge for high-income countries to have susceptibility to network hackers. They have their healthcare system network, and definitely they will equip it with security measures. but it is not impossible for network hacking to occur in high resource setting as well. So this is my own view about the question. Thank you very much. And thank you everyone for your attention.
Thank you so much. I think the challenges are the same, but the resources that we have to address those challenges. So I like to ask from the challenges that what Mrs. Yewande shared, the most important thing that has come out is coordination, lack of coordination, the communication challenges. So Esperance from Rwanda Hub, can you explain to us how does this interdisciplinary collaboration as it play a role in improving the perioperative nursing over handing over practices in our setups?
Thank you, Sankita, for the question. The answer will turn around on the previous thought, like the challenge and that importance they mentioned. As interdisciplinary collaboration, we understand the communication between teams around perioperative care. Those are surgeon, nurses, anesthesia, and beyond, we go through paramedical staff in perioperative, like nutritionists, social workers, there is physiotherapists and others, those who are involved in perioperative care. They have to share information in order that the care we provide to the patient is coordinated, and in that way, the patient receives a comprehensive care. This led to the team became more effective in managing the case because the decision making is made on a timely manner, but also the professionals or care providers get an opportunity to develop their responsibility in patient care, but also their clinical competencies also is developed. Because during the handover, people transfer knowledge and skills between them. They complement each other around the patient care. Because the handing over, it's a time to ask some questions, some clarification around the patient care, but also completing those missing information. This one, it's help in creating a spirit of teamwork, the trust and the respect between members, and it's also help in assuming the safety and the quality of care, which is continuously. It's help finally in reducing or avoiding some medical errors and malpractice. This role of handing over, this moment of handing over, it's help providers to avoid the distraction or avoid giving incomplete information or any misunderstanding around the patient care. So by that, the expectation, which is patient outcome, is met, and that one lead to the satisfaction of both patients, health providers, but also the institutions. Really, the handover perioperative could be cooperative between members, and the leaders have to think on the methodology and the strategy to use to facilitate it. Thank you.
Yeah, thank you for focusing on something called as complementing each other in the team. That's very important. I think that can reduce and the errors that we have during the perioperative handing over situations. And the most important thing that you mentioned was the continuity of care should be safe and it should be quality care. The information that we pass should be quality information. So that will come only when an interdisciplinary collaboration is there. And most important thing is trust and respect for each team members to listen to what the others are saying. Thank you so much on discussing with the interdisciplinary collaboration and the importance of it. Mr. Blaze, as Professor Rwanda discussed about what is the difference and challenges between high and low resource countries, the technology is the one which stands out and which is a challenge that we face in our low and middle income countries. How do you think we can address these challenges? Can you share some thoughts or practices that we can utilize the technology in improving the perioperative nursing handing over practices? Over to Blaise.
Blaise, you will need to unmute your microphone, please.
Hello, is it okay now?
We can hear you now, Blaise. Come in.
Okay, I was saying that hello everyone. It's a great pleasure for me to attend this summit again. You know, nowadays technology, we need it if we really want to be more effective in perioperative nursing. Okay, I would like to talk first of all about before operation. Technology helps us to, how can I say, to prepare physically very well the patient for the operation, okay? It also helps us to disinfect very well the room in order to prevent infection, okay? To be sure that what we are doing, how can I say, safely, okay? In order to avoid to transmit germs to the patients. And for if we wash our hands, in order to be sure that our hands have been very well cleaned, we can check it using technology. And that's all helps us to elaborate protocol, checklists, and so on and so forth. During operation, for instance, technology helps us to reduce errors of asepsis. And by doing like that, that helps us to reduce the complication after work. And the nurses will be very well easy, will be happy to contribute to the recovering of the health of the patients. After operation, for instance, technology helps us, to follow many patients who are in the same room, but the nurse can be in only one room connected to the wall room by the monitors. And after operation, that can also help us to administrate drugs with precision in the wake-up room, for instance, by using electric syringe. That also helps us to reduce the workload. For instance, after operation, nurses will have to dress less wounds, okay? And the technology, you know, nowadays, there are operating tables with many kinds of systems. That helps us to install patient very well according to the position wanted by the surgeon. Apart from that, that also helps us to avoid, while we are watching, for instance, hands, in order to operate, to avoid many mistakes. Okay, and I want to underline that technology helps us to contribute by using many materials, many devices, and to gain time. Yes, to gain time. And once the patient is cleared, it's a pleasure for him to come back and to greet all the staff, and all of us, we are so happy. I would like just to underline that it's a great pleasure for me to attend this, and that is what I would like just to for your kind attention and best of that.
Thank you, Blaise. Does other panelists have anything to add from your experience or practices about using technology and perioperative handing over? Esperance, you want to add something? Okay, I think, yes. Please go ahead.
There is something he said that it's reduced workload. In addition to that, the workload is reduced because there is no repetition in doing the work, like medication requesting. There is also a quick access of some data of the patients, like results, and the team are consumed or are preserved their time spending to go to do paperwork. and the accessibility of those patient data are seen on a timely manner by all personnel elsewhere they are. But also in the capturing some information of patient data like vital sign, considering those monitors says the information are captured on time because there is a continuous and timely save of knowing which sign of dangers the patient is having. If a nurse was in the perioperative in the PACU side and he was busy changing patient position, he could see on the patient monitor that there is something not going well. So direct, it saves time of the patient in decision making. Thank you.
Thank you for your contribution.
Other thing about technology is it can give an overview of what has happened in a pre-operative, intraoperative, and post-operative. So if you use technology, we will be able to see as a trend of vital signs and other things. So, and another thing when we use technology, we should remember is about we need to be giving importance to the assessment of the patients also. So technology can be utilized wisely because it should not become like low touch and high tech. So it should be high tech and high touch approach for nursing. And we use technology in nursing in perioperative handing over practices. And another thing I want to add is that what we are doing in EMU study, we are actually developing, or we have nurses are part of the EMU study where we are enhancing the patient monitoring system using developing a monitor and testing it phase-wise. So we all are involved in that. I think we all should look forward to use technologies and innovations in our practices. Yeah, thank you, Blaise and Esperance, for elaborating about how can we overcome the challenges of technology. And in the chat also, people have written about, the participants have written about training and education. I think whatever we do, training and education plays a very important role. Whatever we new technologies or to address challenges, we as nurses are involved in training and education. So I request Mrs. Amandeep Kaur from India Hub to tell us how can training and education play an important part in improving the perioperative handing over practices. Over to you, Aman.
Yeah. Thank you very much, Dr. Dhruv, Sister Sangeeta, Katie, and everyone for the opportunity provided me to talk about such an important topic of perioperative patient handovers. Now, if we talk about patient handover, then it's just not the transfer of information, but also the transfer of patient's responsibility from one healthcare professional to the another. While providing training and education on handovers to nurses, several important points should be kept in mind, and few of them are: while using standardized checklists for perioperative care, we can formulate and implement this at different time points while receiving a patient. This can be at the time of receiving the patient in a ward, while shifting a patient to the recovery area and then the operation theater, and finally at the time of discharge. Secondly, communication skills of nurses can help them establish clear pathways between healthcare professionals, which is crucial for optimal perioperative care. For instance, special instructions such as keeping the patient NPO, which means the nil per oral, until further orders to prevent the patient from aspiration. This is a small point, but it should be clearly communicated during the handover to ensure its efficiency and its effectiveness. And I think another important point to be kept in mind in teaching ethical issues to the teams, and two major factors to be considered here are maintaining patient's confidentiality. Like during handovers, it is crucial to ensure that sensitive information is shared only to those who need to know. Secondly, information about the patient safety. Ethical responsibility demands that patient handovers prioritize patient safety, as inadequate handovers can lead to miscommunication, resulting in errors that can worsen the patient's condition. We have also seen that the knowledge of cultural sensitivity is crucial and should be a part of our training and education, like respect for patients, respect for colleagues, fostering them mutual respect and understanding among the team during handovers are a few points to be considered under the cultural sensitivity. Education on addressing their legal issues while documentation, record keeping, while ensure a clear record of patient information, care provided, and any changes in the treatment plan. With this, informed consent and communication of decisions is also vital under legal standards. Regular audits of handover practices can identify areas for improvement and ensure adherence to the ethical and legal standards, like review of clinical audits reports on the surgical process to find out the root cause of incidents, and near misses can be used for the teaching the nurses. Once implemented, I think even an observer can be added at the time of handovers to identify potential strengths, weaknesses, and areas for improvement, which he or she can further discuss with the teams in review sessions. And to conclude, I think if simulations can be developed on perioperative handovers, they can become a powerful educational tool that can enhance communication, standardize procedures, improve teamwork, mitigate errors, and build confidence in nurses, especially in country like ours. I think these are the points which can empower and upskill our nurses in perioperative patient handover. Thank you very much.
Yeah, thank you, Aman, for highlighting what are the points that we can use in teaching. Mostly in our teaching, we say that we discuss about the checklist and we say this is how we have to fill. So I think we have to move beyond and say where interdisciplinary communication, the respect, mutual respect, the cultural sensitivity, and all these things should come into the teaching when we teach a perioperative handing over practices. Because many things are assumed, many things are, when we communicate, many people are there in the situation, and it's many times relationship which is affecting the communication between the team. So thank you so much for giving importance to simulation. I think that is a very important tool that we should use. So we learn how to do it properly before we go to the bedside. So next we have Mrs. Lynette from South Africa Hub. Can you share some experiences from the high resource settings on perioperative nursing handing over practices? We have heard from the panelists about challenges and how we can overcome. I think most of the practices that we learn from high resource setting, but we have to localize and we have to find local solutions. We have to learn from them. Can you share some experience from the literature on how they have identified and how they have adapted, and what can we adapt from their practices?
Yes, thank you, Sangeeta, for this opportunity. There's 4 things that I would like to share with everyone. The first one is that my experience, obviously in South Africa, in both high and low resource settings, has confirmed that a quality handover event from one nurse to another is not determined by resources, but rather by commitment of the 2 nurses, and of course a very strong patient-centered approach to the whole process. The second aspect is that we must not overestimate checklists, the value of checklists. A checklist is just what it is. It's a checklist, and it provides us with a framework or a specific order to present information, but it does not indicate that a quality handover event has actually occurred. Even if a checklist has been ticked and signed, it just means that a certain order has been, or process has been followed to communicate information. Number 3 is that if you as a perioperative leader or manager would like to assess what the quality of your handover processes in your unit is, the only way to do that is to have real-time observation sessions of the actual event. By checking the understanding of the receiving nurse regarding patient information. So it's a real-time event, and yes, it is time-consuming to do that. The last point that I would like to share is if we're then going to roll out these guidelines, and I'm very excited about this research project. I think we are going to get real valuable information from the research and develop wonderful protocols, that if we are going to roll it out into our clinical areas, that it needs to be done from a top-down approach. We need to first get buy-in from managers, to actually get buy-in from the nurses that has to follow these guidelines and protocols. Thank you very much.
Yeah, the points that you shared are very valid, like patient-centered. Many times it's not patient-centered. We are talking about other things, but I think the handing over should be patient-centered. So that's a very good point that you have mentioned. And about, yes, audits are done on the documents that are there. The ticks are there, but maybe the events have already happened, which was really not followed properly. So that's a failure or a challenge that we have, and we have many checklists that is given from our administrators to us. We don't know what the bedside nurses need. So we should involve bedside nurses in developing this checklist. So the sustainability of these interventions are there. So mostly whatever we do should be sustainable and should be accepted by the bedside nurses. The most important thing, another thing that you mentioned, was top-down approach. That's also very important. When your managers agree or buy in, then it will be implemented. Thank you so much on highlighting what we have learned from others. I hand over this time to Katie to introduce Professor Aisha.
Thank you very much, Sangeeta, and thank you to all our panelists for such a rich and interesting discussion. We've heard so much about all the challenges that you've been facing in your practice, and also how collaboration and training can help to overcome these challenges. And I think that's really, all of those things will be underpinned by the high quality evidence generation and research that this group's about to undertake. So just a quick update on the poll in the channel. I can see that problems with communication and a lack of standardized guidelines are the most popular choices for the challenges that our nursing colleagues are facing on a day-to-day basis. And I think, as Sangeeta, you highlighted earlier, we have much in common. We share all these challenges, and if we do research and work together, we can start to put evidence-based interventions into place to improve the challenges that we all face. So we're going to move on to a short video now, some words from Professor Aisha Holloway. Aisha is a professor of nursing at Edinburgh University who unfortunately wanted to be here today for our webinar but wasn't able to join us. So she has sent a short video about the importance of collaborative nursing research and how this can enhance quality nursing care.
Hi, my name is Professor Aisha Holloway, and I am Professor of Nursing Studies here at the University of Edinburgh. Good morning, good afternoon, good evening, wherever you are. I'm sorry I'm not able to join you in person, but hopefully the recording will do the trick. So this small presentation is about how collaborative nursing research enhances quality nursing care. No more giants, only crowds. The explanation for that will become clear. Let's move the slide to the next slide. So when I was thinking about this around research collaboration, nurses, patient quality of care, I came to it with an assumption that as nurses, we always strive for quality care, and our care is evidence informed. There are nurses who are undertaking research that are informing evidence-based care. But I think one of the key foundations to ensuring that we have rigorous evidence and that we can grow the capacity of that with nurses leading that research that informs the evidence is through collaborations. So I saw in Nature an editorial that was very interesting around the time of COVID, post-COVID era, thinking about how we collaborated then together as scientists and the rewards, the big rewards that Nature says that research collaborations bring, and that the world needs more. Well, that's great because the world needs more nurses, and it needs more nurses leading research, and informing quality care through the evidence created by the nursing lens, the research lens, and that will benefit science, society, working across borders, cultures and disciplines. So I came across something called the collaborative edge, and I thought that was a nice way to frame this short session around resource sharing, data pooling, interdisciplinary collaboration, ethical guidance, cultural diversity, and increasing the ability to stay ahead of the game. This was a great paper by a Sigma colleague this year. And I'm just going to run through a couple of the key messages that I hope you will take away with you and consider. So to have the collaborative edge, that allows us or enables us to share our resources. That could be personnel, so we have greater capacity with researchers available, so not just one or two, but a greater scope. It could also mean around funding, so coming together for larger pots of money. The other thing that we can get from Collaborative Edge is data pooling, where we can, rather than perhaps have one study site, we can have several, or we can recruit from a number of sites and get greater diversity. And both of those things we see through Global Surge, where that has been possible and very successful. And I think as nurses, we can do the same. And the great network that has been set up by the wonderful Sangeeta, very inspiring, is we're starting to see the benefits of that widening network. We're actually nurse pooling at the minute. We're bringing all the nurses together and sharing that resource. And then there's interdisciplinary collaboration, which for me really is foundational and really the hub of ensuring quality care. Because we can only address the challenges around our patients' health and well-being by looking at it from different perspectives and bringing in expertise that covers all the areas. So if we have an intervention that we know is effective, how will that be implemented? We'll need implementation scientists. How do we know it's cost effective? We need economists. How do we understand people's experience on the ground in communities, anthropologists, human geographers, all of these people, behavioural scientists, all of these people are required. So this is not just really about nursing. This is about interdisciplinary collaboration, but nurses can lead these teams and that happens already, but not enough. We want to increase that capacity. And then there's the ethics and the cultural diversity. We want to be culturally sensitive. The research that we have locally has impact globally. And we want to have rigorous ethical work. So again, if we are collaborating beyond our teams, then that's great for our dissemination, our cultural sensitivity and relevance, and also the rigor of our research. And then finally, coming together as a group of nursing scientists and other disciplinary scientists, then we can stay ahead of the game. We can share knowledge from different parts of the world. We can share understanding, and we can understand also what the next, advancements are and innovation is. So it's not just about operating in silos, it's operating collaboratively across our networks. I've put the reference there and the link, so that should work, and it will take you to that piece. It's very interesting. And Sigma is also offering a network there, a little bit like the Nursing Now Challenge 1000 Study Network you'll find on that webpage. That's a resource and a space for like-minded nurse scientists to come together, have resources, have opportunities for networking, mentorship, experience, collaboration. All those things are really useful. So hopefully that's given you some pause for thought. And going back to the nature piece, and I think this is a great way to finish. The metaphor, standing on the shoulders of giants, has been much overused by scientists past and present and nurses. Today, such giants are not only the investigators named on papers and project grants, but also every other participant in the research process. And I think you will both understand, it will resonate, that as nurses, we have largely been collectors of data. We have largely worked on other people's research, but now we are moving faster and with greater capacity to be the leaders of this research, to be the chief investigators. And we are not about standing on the shoulders of giants. And as it says, the future lies in standing on the shoulders of crowds. And for me, that's crowds of nurses. Thank you so much for your time today. I hope you've enjoyed it, and I hope you enjoy the rest of the session. Take care. Bye.
Thank you to Professor Holloway for those really inspiring words about how we can form our own crowd and become giants of that crowd. So we're coming to the end of the webinar now, and I would like to invite Sangeeta back to talk about the research project that we're planning. And as Sangeeta's doing that, we're going to have the final poll of the webinar, which asks whether you would be interested in joining our research collaborative and taking part in our new research project. So I will launch that poll now, and feel free to vote as Sangeeta describes the project.
Next slide, please. So as Professor Aisha said, we have to be standing on the shoulders of the crowd, and we have to lead research projects. So as we shared the Delphi results, part of the Delphi results, it was the patient care, patient safety practices that we want to work on. So as collaboratively, the nursing leads from all the GSU hubs, we have worked on this research proposal, which is titled Enhancing Perioperative Nursing Handing Over Practices, a comprehensive research proposal. So we aim to evaluate current practices and challenges in perioperative nursing handing over, and to address these challenges by developing an evidence-based standardized perioperative nursing handing over tool, which can be used by nurses for safe handing over of perioperative patients while being accepted by the perioperative nurses. So this study will be done in 3 stages. So that the objective for phase 1 will be to explore the current practices, workflow, process flow, challenges and gaps in perioperative nursing handing over in low and middle income countries. Phase 2, we will be developing and validating evidence-based perioperative handing over tool that will be used by the nurses. And phase 3, the validated developed tool will be implemented in the low and middle income countries, and it will be correlated to the patient outcomes and nurse satisfaction and feedback. Next slide, please. How we are going to do is we are planning to utilize a mixed method approach, combining qualitative and quantitative research methodology for the comprehensive understanding of perioperative nursing handing over. So the study will be done in Benin, Ghana, Guatemala, India, Mexico, Nigeria, Rwanda, South Africa, and in UK. The participants will be perioperative nurses. In phase 2, for validation, we are thinking of giving to the surgeons and the anesthetist to get the tool validated. The data collection will be done through structured surveys, semi-structured interviews, direct observation, and focus group discussions. Next slide, please. So we welcome you all to be part of this network and be part of the research. So we generate evidence together to address the challenges that we discussed in this panel discussion. I believe that when we are together, we can solve the issues that we face in nursing. In nursing, we have to find solutions for our challenges rather than expecting somebody else to give the solutions for us. Thank you so much.
That was super, Sangeeta. Thank you very much for sharing the plans for this exciting new project. I'm delighted to tell you 97% of our audience are keen to take part, so we're going to have plenty of participants. I'd now like to invite Vinitha Ravindran back to take the microphone and to give us some closing remarks around our collaboration. So thank you, Vinitha. I wonder if maybe we could keep the QR code up, which has the joining. Thank you, just so that people can scan that with their phones and access the sign-up sheet if they wish. I will also put the direct link in the chat. I'm not sure if people can access the chat, but I'll put it there anyway. Over to you, Vinitha.
Okay, thank you, Katie. It's been a wonderful time of listening to different people from different countries, and we have for the past 30 to 40 minutes, we have heard about the challenges that we have in handing over and the differences in the high income or high resource settings, like having good guidelines, systematic way of doing things, having good protocols, good technology, which is often the challenges that we face in low and middle income countries. And we also looked at some of the interdisciplinary aspects that really enhance handing over, like importance of sharing information, especially points such as quality information, complementing each other, collaborative decision making, having trust and respect for each other. And another thing that we very often talk about in emergency situations is closed loop communication, where we are very clear what we are saying to another person, and the other person, we are clear that the other person has understood what we have shared as information, which is also important. We also looked at how technology can improve our handing over practices and how it can reduce workload, reduce time, and improve documentation, and also how we can look at the processes in the patient's condition through the technology looked at. And we also know, as we have discussed and we thought about technology, we know that's something that is a challenge in many of our settings. And we work, even without technology, we work around it and we try to work effectively. And we also looked at how not only information, but the responsibility and improving our responsibility and knowledge through education and training. And very nicely, it was highlighted how important it is to get immediate feedback by observing what's happening or introducing simulation in training, so that the nurses will know what the handover practices are and how important and how well it can be done. We also looked at research and the importance of collaborative research in improving our status as nurses and nursing care, and how important it is to participate in anything that is happening. And we know that research really improves patient outcomes, because based on the evidence that we create, we can improve practices, implement new interventions, so that our total outcome, especially in terms of patient care, really improves. So it has been a wonderful evening of listening to the experts talking to us on different aspects of perioperative nursing care. And I really at this time take the opportunity as a concluding part, thank all the panelists for sharing this rich information on these aspects. Thank you. Over to you, Kate.
Thank you very much, Vanitha. We're going to close the webinar at that point. I'd like to thank Sangeeta for leading this new research initiative. I'd like to thank all of you for joining as participants and forming the crowd together with us. I'd like to thank all of our panelists for such a rich discussion. And I really look forward to working with you all moving forward into an exciting new research project ahead. Thank you, everybody, and good night.
Thank you, everyone.
Thank you. Thank you.